Good afternoon. Thank you for joining us on our Monday COVID-19 update. We will once again try to provide as much information as possible to the people of Tennessee so you know what we're doing and our efforts in the state to mitigate the effects of COVID-19, both from a health standpoint, from an economic standpoint, and to encourage you in what you can continue to do personally to address this and to provide safety for you and for your neighbors and for all of Tennessee. Today we're going to discuss a series of trends that we're seeing across our state. We're going to talk about grant funds that we've opened for rural hospitals and for local governments, and we're going to give an update regarding our surge planning here in Tennessee. Let me give you the numbers first. There are 3,802 confirmed cases. We have lost 65 Tennesseans to COVID-19, which reminds us of why it is so important that each one of us do our part to attack this in our state. And we have had 356 people recover from the virus. Earlier today, I spoke with Vice President Pence and governors from across the country about the aggressive efforts that each state is making and that the federal government is making regarding testing and acquiring and acquisition of much needed personal protective equipment. As of today, Tennessee has made 1,000 shipments from TEMA to every county in our state. Many counties have received multiple shipments, and we are very encouraged about our ability to stay ahead of the need in every area for personal protective equipment. When we find a need, we address it. And as I said, we've made 1,000 shipments. We are making sure that every community, every first responder, every healthcare worker has access to the personal protective equipment that they need. Consistently, by the way, more than 70% of these shipments are going to rural communities because we know they need them just as much as our big cities and our suburban areas. One of those pieces of equipment that we are all very interested in across the country is ventilators. And I just want to take a moment to thank a great Tennessee company who has, in fact, stepped up in the volunteer state way. HCA, a company located right here in Tennessee, is making shipments of ventilators to our neighbors to the north in New York and in New Jersey, where the need is the greatest. And we are proud of what HCA is doing. They're a great corporate citizen that show just what Tennesseans, the spirit of Tennesseans is. And let me just add too, we have had multiple companies across our state step up and both manufacture, volunteer, contribute personal protective equipment. They have done a tremendous job in being a part of the solution for us. The private sector, the nonprofit community, citizens from across our state are volunteering and are making substantive contributions to this need for personal protective equipment, and we're proud of those efforts. Over the last 48 hours, we have seen some positive trends in our state and across the country. It is a welcome relief to get some good news. But we also want to encourage Tennesseans that while we have received some good news, we need to stay vigilant in our efforts. Social distancing works, and the improvement in numbers that we're seeing today are the result of decisions that we made 2 and 3 weeks ago. We still need Tennesseans to remain home if they're able to do so, in spite of encouraging information. Data changes every day, but we need Tennesseans not to change the way that they are making efforts, the way that they are staying home, the way they're serving their neighbors, the way they're helping the elderly stay distanced. Data changes every day, but Tennesseans need not change in their vigilance to remain socially distanced and to continue to do the things that have in fact begun to show positive efforts. We need to double down so that we can continue to make positive change. COVID-19's placed a considerable strain on our small and our rural hospitals, especially as elective procedures have been suspended and federal funding still hangs in the balance. We don't have enough guidance around federal funding for hospitals, and our small hospitals and rural hospitals are struggling as a result. So today, we've announced $10 million in grants to keep small and rural hospitals open and to offer services, for them to continue to offer services as we bridge the gap between now and the time federal funding comes for those hospitals. Local governments have also felt the extra strain of COVID-19. Our fiscal year 21 budget set aside $200 million to help county and city governments use grant funds for capital maintenance and public safety and road projects, but also for COVID-19 and for tornado relief. Those expenses will be covered in these grants, and the application will open on April 30th for these local counties and cities, and we encourage governments to apply for those funds. They will be available starting July 1st when the new budget year starts. Also during the COVID pandemic, we need all Tennesseans to seek appropriate medical testing and treatment to better ensure their own safety, but also the safety of their families and their neighbors and everyone across the state. As we've seen, the President and Congress working together in a bipartisan manner have acted. They've provided funding for COVID-19 testing for any Tennessean where that testing is deemed appropriate. And this was an extremely important step. In addition, the federal government is assisting state Medicaid programs with additional dollars to assist states in serving their existing Medicaid population, recognizing the increased burden of Medicaid programs throughout the country. We know our hospitals and healthcare providers are on the front lines, and they're facing and will face significant challenges in the days ahead, both from a capacity standpoint and a financial standpoint, as they serve the entire population, both insured and uninsured. In previous briefings, I've communicated that we were in discussions with the federal government on a program to address treatment for the uninsured. Our Division of TennCare has submitted a waiver application to the federal government in recent days seeking federal matching dollars to address the uninsured population in our state. And also last week, we received indication from the federal government that guidance is forthcoming on how funds from the CARES Act will be directed to providers to cover the uninsured. Whether through approval of our waiver or through funds coming to Tennessee through the CARES Act, we anticipate the federal government will step forward and partner with us. We're committed to addressing this issue of the uninsured. We believe that everyone in this state will get the treatment they need for COVID-19, including the uninsured. So we anticipate that guidance will come soon and that we can stand before you with a plan to address this need in the days soon ahead. I want to address surge planning, but I want to ask General Holmes to give an update regarding our efforts with the U.S. Army Corps of Engineers to surge plan and build out additional capacity. General Holmes.
Thank you, Governor. Just a quick update on our military personnel currently on duty. By the end of the day, we'll have well over 500 military personnel on duty, and that includes portions of our State Guard with medical specialists. We also are bringing in retired military medical personnel, just exhibiting the volunteer spirit. It's in their DNA to ride to the sound of the guns, and we're seeing that, and we'll bring them into our State Guard. Well over 250 of that 500 have medical specialties, and we're trying to build, and we have built, a large reserve capacity. So we have the ability to surge and staff in facilities, alternative care facilities, and things of that nature. Our main effort continues to focus on testing. We're currently manning 35 rural testing sites. We'll continue to do that, and we have rotational teams so we can sustain that indefinitely. I would like to remind everybody that our mission is a humanitarian mission. So we do not do law enforcement. There's no need for us to do law enforcement, and I would just advise everybody of that, because if these testing sites become, if there's a lot of testing capacity happening, our soldiers and airmen will most likely do traffic control around that. And I assure everyone that the questions that are being asked are solely for the benefit of assessment for testing. There'll be no other questions asked outside of the Department of Health guidelines. Alternative care sites with the Corps of Engineers. We have Lieutenant Colonel Avashaw here available for questions. I'll tell you that they've assessed over 35 facilities through all regions of the state. I won't really update all the exact locations, but they're in every region of the state, and we have approval to progress into phase two, I should say, which includes the build-out in all regions of the state. Collectively, at this point, these sites will produce over 3,000 beds. And I say that in round numbers because once you get into the facility, these beds may increase or decrease depending on the suitability of the space. We're going into this with a 75% solution, and we figure out the other 25% on the ground. But we have achieved the capacity, and I would tell you that the state is in the best possible position to meet those demands when they arise. I got to give credit to our Memphis and Nashville district headquarters. It's a very strong partnership. We've, unfortunately or fortunately, we've developed this partnership over many responses to various floods and that nature, but it's a solid team. We didn't exchange business cards 2 weeks ago. We know them, they know us through TEMA, and through that partnership, that's allowed us to get at this aggressive mission. And I'll stand by for questions. Thank you.
Thank you, General Holmes. We're certainly grateful for and proud of the way the National Guard has stepped in and assisted in our efforts. I actually spoke with both mayors of Putnam County and Cookeville today. We are continuing our efforts regarding the tornado and the damage and the victims of tornadoes as well. And they both communicated with me the tremendous help and assistance that the National Guard has provided them from the very early days of that tornado disaster, and the efforts continue there as well. As well as TEMA and FEMA and the work on the ground there. So we want the folks that have been victims of the tornado to remember that we are continuing to work with you as well alongside with this COVID-19 work. And I will say the National Guard has been an important part in assessments in these remote assessment centers across the state. I continue to be incredibly proud of the way that Tennessee has been a leader in the country in testing. We were one of the first 5 states to test for COVID-19, and we have stayed in the forefront of testing since the very beginning. That is incredibly important as we address this virus as it moves through our state, because the more we know about the people in Tennessee and the numbers of folks who have contracted the virus, and the only way we know that is by testing. So the more we test, the more we know, the more informed we are about the right kind of choices that we will make going forward. We're continuing and continue to push for testing. We are in a place where those who qualify for testing, none are being turned away. We have capacity in this state, and we hope to continue to ramp up that capacity, which will be one of the ways that we will have the outcomes that we want. So we're grateful for that work. Regarding testing and really just for a health update in general, I'm going to ask Dr. Piercy to come up and make a few comments before we have questions.
Thank you, Governor. As the Governor mentioned, we have 3,802 cases today, and we have done 47,350 tests. This does put us as one of the top testing states in the nation. We have brought one of the 45-minute platforms online in the last week, and we are also planning to bring the new 5-minute test online as soon as we get it in hand in the next week or so. This will significantly enhance our efforts of testing and be able to provide it on a much more widespread scale. I do want to address the reduction in the rate of rise. As the Governor mentioned, and as you may have noticed, our new cases each day appears to be slowing down. That means what you're doing is working. Please keep it up. This is not the time to let up on those efforts. This is the time to keep pushing forward because what you're doing is working. I do want to tell you another number that is going up, but I want to explain it to you, and that's the number of deaths. Yesterday, our death total was 44, and today it's 65. That's essentially a 50% increase overnight. That doesn't mean that we had a particularly bad day yesterday. It means that the time it takes for people to get sick and then as they get sicker and ultimately succumb to the disease, that takes about 2 weeks. And so what we're seeing, or we're starting to see the increase in hospitalizations and death from the swift uptick that we had a couple of weeks ago. As you may have heard the Surgeon General say, and as Dr. Fauci and Dr. Birx said on a call this morning, this is going to be a pretty tough week for both hospitalizations and deaths. So please remember those families in your thoughts and in your prayers. Finally, I want to close the loop on the Gallatin Center for Rehab and Healing. As we continue to monitor that situation and start to transition those efforts back to the facility, I do want to reassure you that we are continuing to work closely with them. We had multiple folks in their facility late last night, and we continue to find no deficient practices and find their response to be perfectly adequate. So I just wanted to close the loop on that and help them get back to normal as quickly as possible. Thank you.
Thank you, Dr. Piercy. For questions, we have members of our Unified Command Group here as well, and so you can use those experts to ask questions as well. Let me close with a couple comments here before questions. While it is encouraging that we have seen some data moving in the right direction, I want to urge Tennesseans to remember that data changes, but we have to be committed to not changing in our vigilance, in our diligence, and in our efforts to stay home, to stay away, to stay distanced, to continue to do the things that are working in this state to help us mitigate the tremendous effects of COVID-19 in Tennessee. I've said many times there's a storm over our state. It will pass over. And it will pass over more quickly if we all stay committed, if we all maintain an attitude of hope and an attitude of cooperation. We will, in fact, have outcomes that we are all proud of when the storm passes and the clouds clear. And your participation in that is the most important piece of that. We can do a lot of things here at the state, but individual Tennesseans engaging in what you know works is how we're going to fight COVID-19. Do your part and stay apart. Thank you very much, and we are happy to take questions.
Thank you, Governor. First, we'll go to Jonathan Mattice from the Associated Press.
Hi, Governor. Last week there was a state prison inmate who tested positive. And I was wondering if you had an update on how many inmates and staff have tested positive at TDOC facilities, what the criteria are for inmates and staff to be tested, and if there are any plans in the works to reduce the state prison population like is happening with some local jails now.
I'm going to let Dr. Piercy answer that to talk about the specific plan we have in place for correction.
Hi, Jonathan. You're correct. We have had one inmate test positive and a total of 3 staff members. Some of those are contracts, some of those are state employees. In each of those situations, there has been significant efforts to do contact tracing on all of those and to make isolation and quarantine efforts where appropriate. We do have a few more pending tests of individuals that were exposed to those that were positive, and so it would not be unexpected to have a few more. The TDOC commissioner and I are in almost daily contact talking about how to best protect that patient, or excuse me, that inmate population through the use of PPE, through the use of isolation and quarantine and visitor guidelines.
Thank you, Jonathan.
Thanks.
Next, we'll go to Chris Bungard, WKRN.
Hi, Governor. Sumner County, as you know, leads the state with 15 deaths attributed to COVID-19. What do you attribute that to?
Dr. Piercy, do you have numbers about that, around that, and what might be the case there?
Yeah, so the question is about Sumner County deaths. You do point out correctly that there have been 15 deaths there, which is a pretty large cluster for a relatively small county. Some portion of that is from the Gallatin nursing home. That is why it is so incredibly important that we take care of these vulnerable populations, because their mortality rates are a lot higher. The last I heard, only about 5 or 6 of those 15 were associated with the nursing home, but I could have that number a little bit, it could be a little bit low. So not all of those are attributed to the nursing home, but a significant cluster is.
Does that give you pause then, that if there's still 10 deaths out there that aren't directly attributed to the nursing home, and as you mentioned, the disproportionate size of Sumner County to hotspots like Nashville or Shelby County?
Yes, sir, that's a legitimate question. I don't know that we've identified any patterns outside of the nursing home. I don't really, not really familiar with the demographics of Sumner County overall, but we know patients that are older and sicker do have higher mortality rates, so that's all I could speak to in general there.
Next, we'll go to Andy Scher from the Times Free Press.
Hi, Governor. How you doing today?
Good, Andy, how are you?
Doing fine. Let me ask you this. Every Friday, the state of Georgia releases a report which identifies by name of facility which long-term care nursing homes and long-term care facilities have patients, COVID patients, and/or staff with, with infections. But Tennessee does not. Given that Georgia can do this and doesn't see a HIPAA problem in releasing this information, how does Tennessee justify not releasing which facilities have infection?
Yeah, that's a good question, and actually something we're working on. So as we've talked about data points through this entire response, you've probably heard us say multiple times, this is outside of our typical protocol and not what we typically release. We don't find it to be a HIPAA violation to release that. We just started collecting that information, and so we have to get through that process of collecting that information, but we are working towards being able to identify those facilities.
Thank you very much.
Next, we'll go to Hannah Walsmith with WMC. Hannah, your line is open.
Hey, Governor Lee. Governor Asa Hutchinson with Arkansas announced that their schools will be closed for the rest of the year, in-person classes. Do you have any plans for Tennessee schools at this moment?
Well, our plan is to assess the situation. As you know, we're closed until later in April, the last week of April, and we'll be watching the information that comes out every day and making those decisions when we feel like it's the right time to make that decision. I will say that on Thursday, our commissioner from Department of Education will be in here to answer questions around education and the things we're doing, efforts we're making to make sure that our kids are well educated to the degree they can be in the circumstances we're in, that they're fed. For those who receive their food, their breakfast and lunch through schools. So we will be assessing that situation and making decisions about it when we know more about what the days hold for Tennessee in the days ahead.
Next, we'll go to Brett Kelman with the Tennessean. Brett, your line is open.
Hi, Governor. So at the beginning of this presentation, you spoke about the somewhat encouraging modeling, and you showed the University of Washington model that I think we've all been looking at. That model is built on the assumption of full social distancing practices through the end of May. And I'm curious if, based on this information, you are considering that type of expansion of the policies you've put in place.
Well, what we're doing is we're using that model to inform decisions that we make here in Tennessee. So that model has changed dramatically just in the last week. And we expect that these models will continue to change dramatically, and we will continue to follow those changes so that we can make decisions that are specific to our state. The numbers are very encouraging in that model, and because of that, we're going to follow them closely, and we're going to continue to monitor things right here in our state so that we can make decisions as we have made in the weeks past. But I can't, I'm certainly not in a place where we're considering changes to the policy that we have right now. So no, we're not looking to extend any decisions that we've made until we deem it appropriate.
Next, we'll go to Alex Apple with Fox 17. Alex, your line is open.
Hi, Governor. Thanks for your time. Two quick questions for you. The first, perhaps just a yes or no answer. I think you had said that you had been waiting on some guidelines from the federal government about how to get unemployment benefits to people that are self-employed. I believe you've gotten those. Are you going to follow those guidelines? And the other question that just came to my mind as you were speaking today was when you mentioned the $10 million for rural hospitals. I know that will be well received by a lot of those communities. But are you reconsidering what a couple of your fellow Republicans in the legislature proposed this year and looking at a Medicaid expansion, which could be a couple $100 million for Tennessee's healthcare system?
Well, with regard to the Medicaid population, we're looking to see how much federal funding is going to be expanded to that population as a result of COVID-19. We know that there's going to be expanded dollars to our current population, and our focus has been on the uninsured for COVID-19. And as I said earlier, we are working with the federal government to get an answer regarding our waiver specifically, and the particular request that we have for them to provide funding in conjunction with the state. But we also believe that they are making efforts to provide outright funding for the uninsured. We're committed to making sure the uninsured are treated and served in this state for their COVID-19 health-related expenses. Beyond that, we're not looking to go beyond that. What was the first part of your question? Oh, regarding the unemployment benefits for, yeah, we're looking at their guidance, and we'll be making a decision about whether or not we're going to follow that. We haven't made that decision yet.
Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Good afternoon, Governor. And to follow up on the previous question, you've talked about plans to make sure that the uninsured will get treatment for COVID-19, but more than 300,000 Tennesseans were uninsured before this economic crisis, and that number is likely to go even higher with people losing their jobs.
Right.
Would you be inclined, or would you consider using your emergency powers to follow the lead of 38 other states and accept what Governor Haslam called free money from the federal government to do a full Medicaid expansion so that no Tennessean will have to worry about health insurance after this?
Yeah, what we're focused on right now, Phil, is the effects of COVID-19. Those are the policy decisions that we're making, and we're committed to finding a way to make sure that every Tennessean is served in their health needs for COVID-19. Those are the decisions that we're making right now, and we're not considering additional decisions around that.
So what would you say to those Tennesseans who've lost their jobs and are now not going to have health insurance when this is over?
I would say
not just for COVID-19, but for everything.
Yeah, I would say that we're going to do everything we can to provide relief to folks who have lost their job. We're doing so with unemployment benefits. We're waiting for guidance from federal government and for the actual dollars from the federal government. We're also looking to provide relief for small businesses so they can get started back up when the time is right in our state, so folks can go back to work. We actually really believe that once we get through the health crisis, then the economic impacts will begin to improve. Jobs will open back up. People will become employed. And we can start back to an economic recovery that will provide relief to many that find themselves unemployed today. We certainly hope that they will not be unemployed in the future.
So for those who do not get jobs immediately, why not give them full Medicaid coverage?
Well, we are focused, as you know, on the effects, and as I've said, on the effects of COVID-19 right now. It's an enormous challenge for our state. We're addressing it economically, and from a health standpoint, those are the things we need to be focused on right now. That is the crisis that Tennesseans are facing, and those are the decisions that we're making today.
Next, we'll go to Sam Stockard from the Daily Memphian. Sam, your line is open.
Yeah, thanks, Governor. Appreciate your time. Under the travel estimates that you showed last week, it appeared that the travel had dropped dramatically under the state figures during the weekends, then rose a little bit on, say, Monday and Tuesday as people went back to work, and then dropped back off the following weekend, then bumped back up. But then you said it had returned to pre-COVID levels, but I didn't see any pre-COVID levels on that. It looked like it was just dropping on the weekend and coming back up a little as people went back to work. How could you, yet you said you justified or used that to justify the stay-at-home order. Can you expound on that?
Yeah, I think if you look at those numbers, you'll see there was a consistent drop over several weeks and a fairly dramatic rise in the period of time following the greatest decline. And that dramatic rise is what caused us. And I actually said that we were moving back toward pre-COVID-19 results. We did not get to those results, and I wanted to make steps to keep us from going back to that, because we know that social distancing works. And we know that anytime we can take steps that encourage Tennesseans and that set up an environment for people to not travel as much and to not have a reason to go out, then we know that there'll be more social distancing. And that's what the efforts were, and the evidence showed that, and that's how we made that decision.
But are you seeing any drop in the last day or so since you made that order? And are you still seeing people out congregating at some little restaurant spots and parks and things like that?
Yeah, we have seen the traffic patterns reduce again, and we'll continue to monitor those and follow those. I'm very proud of the way Tennesseans have responded. I got to tell you, we see the results of what Tennesseans have done. We see that there is encouraging results. The numbers are starting to show improvement. Those are very hopeful. It's all the more reason we need to double down. All across the state, we've seen Tennesseans step up and respond. We've seen compliance with the guidance that's been given. And where there has been an issue or an instance, we've seen education and we've seen law enforcement step in, and we've seen people comply. Tennesseans are engaging in this in a great way, and it's working. We have a long way to go. We have hard days ahead of us. We have a tremendous need for people to continue to engage, but we made the right decisions at the right time, and we're hopeful for the continued improvement and outcomes. But we're not going to slow down. We're not going to slow down in our efforts, and we're not going to slow down in encouraging people to continue in the ways that they've been responding and staying apart from one another.
Thank you.
Yes, sir.
Next, we'll go to Stephen Elliott from the Nashville Post. Stephen, your line is open.
Thank you. Thank you, Governor. So last week, when the number of new cases went down a couple times, we were told not to take that as a trend or a sign of good news. And this week, we're being told that it's encouraging. So I was wondering what gives you confidence that that's more of a trend now?
Yeah, there's a couple things that have caused me to say that things are encouraging. One is the model, the Washington State model that was updated to provide new information about the surge. That's really the information that we've received that we believe is most encouraging. It is true that as we see our numbers decrease to the degree that they're increasing, in other words, the increases are less than they have been in the past. And last week that occurred 1 or 2 times, and I've said many times, 1 or 2 days worth of data doesn't make a trend. And we are actually seeing that there are a number of days that we have had a consistent level for new cases. That's good news. It looks like it's beginning to be a trend. So that's encouraging. It's not definitive, and it's not a definitive trend, but it's something that we're encouraged by, along with the modeling that we've been using that shows that our state may in fact have a little bit less of a surge at a little bit different time. So there's a number of things that look encouraging, but we're all very cautious in folks not misinterpreting the encouraging news and meaning that this is over or that we are not going to have a surge. We want people to stay committed to this process. As I said, there is a storm over us and it's passing. We want it to pass quicker, but make no mistake, we are in the midst of a storm. We just lost another 21 Tennesseans in the last 24 hours as a result of this. So we're encouraged, but we're staying vigilant.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
Yeah, I think I just made it in that we are encouraged, and you should be too. We are hopeful, and you should be too. But we are continuing to be committed, and we need you to be too. This spirit of cooperation, spirit of hope, spirit of diligence and vigilance, this continued effort that Tennesseans are making, that we are all very proud of. I'm most encouraged by the fact that Tennesseans are doing their part to stay apart. That is how we're going to overcome this. We will overcome it. We will get beyond this, but until then, we need every Tennessean to take personal responsibility and engage in this as we attack COVID-19 in Tennessee. Thank you very much.